And if you read through these different questions that you would ask to assess the learner, you'll see that they relate directly back to those theoretical models that I've given you already, the health belief model and the trans-theoretical model. We're looking at what their characteristics are and the literacy level. What are their needs for health promotion, risk reduction, or health problems? What do they already know, and what skills can they perform? Are they motivated to change unhealthy behaviors? And what are those barriers and facilitators? In a nutshell, one of the programs where the students were working with children is they asked them, what do you know? And then, what do you want to know? And then, what did you learn to evaluate? Is they asked them, what do you know? And then, what do you want to know? And then, what did you learn to evaluate? I'm sure you've learned about goals and objectives already because of the nursing care plans that you've had to do. But I'd like to review this just briefly again. The terms goals and objectives are sometimes used interchangeably, but that's wrong because they are different. Goals are broad and sometimes very difficult to measure. But the important thing about goals is that they help us focus on the big and important picture. From this goal that you see here, one could write a set of related and specific learning objectives. So in this example, the goal is that the clients will develop healthy sleeping habits. And a goal is a statement then that describes in broad terms what the learner will gain from instruction. A learning objective or behavioral objective is much more specific than a goal. So if you look at it, it's very measurable. The client will identify 3 actions that can be taken to improve the quality of sleep by the end of the presentation. But remember, what you're doing is beginning with the end in mind. So if you look at that learning objective, that's what you should see if someone learns the material. Writing objectives, and again, just a brief review, they need to be client-focused. What is the client going to do? Not what is the nurse going to do for the client, but what is the client going to do to change their behavior? It refers to a specific subject like smoking. It can be readily measured, so you don't say they would understand something, but you can say that they would describe 2 factors or identify them. Use a verb for stating the outcomes. List is one good verb. So you have that measurement part with 2, 3 reasons, but then identifying, listing, those verbs need to be very clear. And then, of course, put in a specific time frame within a month, by the end of the presentation, whatever. But you need to be sure to keep a time frame in there so that you know when to go back and evaluate. But let's talk a minute about realistic objectives. You need to keep it simple. And use no more than 3 per lesson plan, because you can share these objectives with people that you're teaching. In fact, you can develop them with them. But you give the user specific actions and recommendations and clearly state those actions. So first, people need to know what to do. Then you can talk about why. But focusing on behavior rather than underlying principles first is very important. And that is realistic if you have a short period of time and you need to teach something very important. In planning, you'll have a content outline. You'll pull together the content that is important to teach. And think about, when you look at that content, what's the level of it in terms of understanding? How complex is it? What is the reading level? Is it appropriate for a particular culture? When I mean reading level, I'm talking about, is it at a 12th grade reading level and you have a group of people who have 5th grade education or below? Think about the strategies when you're planning and being sure that they fit with the objective and the content. So if the objective is about psychomotor skills, and the content tells about those skills and how you perform them, then the strategy would be to have someone demonstrate or role play in relation to performing that skill. And then you have to think about the materials you would need. So if you're teaching children to brush their teeth, hopefully you can get some of those big teeth with a large toothbrush to use. And maybe you'll give them a handout that has big pictures on it of what they need to do. And again, when you're looking at teaching strategies, and I have a few slides here to go over that, but you have to consider how people learn and those population characteristics. Simple to complex, as we said before, and then be very sensitive to their energy level and anxiety. I always think about someone who's just gotten a terrible diagnosis like having cancer, and then we try to teach them a lot right after that. Probably they're not paying attention. They can't because they're so focused on that diagnosis they just had. This is not a good time to teach. I think this last one, though, varying methods to hold the learner's attention is very important. If you just stand and talk for a long time, people will quit listening after a while. The next few slides, I'm not going to go over every particular thing, but they do refer back to some of the theories that you've had, and then what are the kinds of teaching strategies you would use. So, for example, for affective learning, you have a recognition of values, attitudes, and beliefs. So how will you teach to help with affective learning? Through discussion, through role playing. When you're making a teaching plan, think about these particular factors as you choose strategies. Here are teaching strategies for different developmental levels. So when you're looking at age and stage, children, preschoolers need simple language and games and songs and rhymes. Adolescents need more cooperative learning and problem-based learning. And seniors like demonstration and role playing, but with attention to where their mental health is at that time. And then evaluation. And always think about pre-test and post-test. What do people need to know? What do you know already? What knowledge, skills, and attitudes do you already have, just like we talked about before? But then looking at what have people learned? What knowledge, skills, feelings, and attitude changed after your teaching? To sum up, let's look at these 6 principles that guide the community health nurse educator. There's a message that we have to send clearly. We have to select the best learning format and environment. We have to organize positive and meaningful experiences. We have to engage people to participate in their own learning. And we have to be sure and evaluate and give clear feedback to the learners themselves. Finally, as we develop effective health education programs, it's not just about that clear message and freedom from distractions, but we need to be sure to provide information that's understandable to the learner. And this relates to health literacy, using plain language, avoiding jargon. And more information about this is in the next section in this module related to health literacy.